This is Selma Schimmel, and you are looking live at the great city of Chicago, which is once again playing host to the American Society of Clinical Oncology, ASCO. This is ASCO's 49th annual meeting, and this year's theme could not be more appropriate: Building Bridges to Conquer Cancer. More than 30,000 of the world's foremost cancer specialists are here, and so is the Group Room, making our 15th appearance at ASCO and one of our very best. Joining me now is Dr. Amy Abernathy, President of the American Academy of Hospice and Palliative Medicine. Dr. Abernathy also leads ASCO's Virtual Learning Collaborative for Palliative Care, and she is the Associate Professor of Medicine and Director of Duke University's Center for Learning Healthcare. Welcome, Dr. Abernathy.
Thank you.
I'm very pleased that you're here with us today because one of the big initiatives that Vital Options is working on in collaboration with ASCO and C-Change is this whole issue surrounding palliative care, the education and the information that we want to share with the public, with patients, with family members, with the medical oncology and the medical community in general.
Really, palliative care needs to be a part of the national conversation. And I think that one of the critical things that you're saying here is that we need to see it from multiple faces, from people who need it today, and all of us are going to be patients in the future in some way, shape, or form. We actually have patients today, and thinking about the importance of a focus of quality of life, symptom control, and best care regardless of length of life is important for all of us. In addition to being a patient conversation and a community conversation, this is also a conversation between us as physicians and healthcare providers, where we have the opportunity to think about our own practice and think about our community of practice and try and figure out how do we organize ourselves, equip ourselves with the right skill sets, and also partner among the different kinds of providers to get what we need for this particular patient. So it is time for the conversation.
Define for us this new extension, what palliative care, because when you say palliative care to a lot of people, it's immediately end of life. Well, palliative care for some people may be very short term to deal with something acute, but for a great many people, it's a stepping stone, a stage to where you might get towards the end of life and ultimately to hospice care.
Palliative care has a portfolio of solutions. So some of them are around better symptom control, including better pain management and nausea and vomiting, and many of the things that have been in our oncology core book of skills for a long time. And sometimes the palliative medicine specialist has additional sophistication that the oncologist might not have in their toolbox. It's also helping to set goals with the patient. What's the goal for you within the context of your health care, and how are we going to do some advanced planning for what we hope won't happen, but need to have some plans in place in case it does. So basically, hope for the best, but plan for the worst just in case. So another important part of palliative medicine in the toolbox is goal setting. Well, it's really hard to do goal setting and better focus on quality of life without a third part of the toolbox, which is excellent communication skills. And so one of the palliative medicine skill sets that often is an important capstone to the oncology space is the ability to really focus on communication as its own discrete thing that we want to do well and has a specialist function. Another part of the palliative medicine toolbox is actually recognizing that what we have to do is often pull from providers of all different types, recognizing that sometimes it's important to have the psychologist available or the nurse and figuring out what the nurse's role or how we help take care of a person in their home. But actually also sometimes we need to focus on spirituality or bring in the chaplain or some other resource that focuses on where people are. And I think that, you know, in addition to best symptom control, goal setting, communication, and interdisciplinary care team, the other core skill that the palliative medicine specialist brings to the table is helping to connect among all the different healthcare providers too. So helping to communicate with the oncologist what this person's goals are, and maybe this person's cardiologist, their general internist, and helping those individuals figure out how to work together as a team. That doesn't diminish at all the important role of the oncologist, but rather is a critical partnership with the oncologist.
In the most intimate and personal way, what you do with patients is incredibly private. and meaningful.
I think one of the things that's special about palliative medicine is that people reward you with the opportunity to be a part of their lives and understand what makes a difference for them, and you get the freedom to help in any way that this person deems meaningful. And sometimes it is medicine's in my toolbox, and sometimes it's really sitting down and talking through, okay, what's going to be the most important things to do in your life over the next couple of months, and how do we figure out how to help that happen.
Thank you, Dr. Amy Abernathy, President of the American Academy of Hospice and Palliative Medicine. Dr. Abernathy also leads ASCO's Virtual Learning Collaborative for Palliative Care, Associate Professor of Medicine and Director of Duke University's Center for Learning Healthcare. Thank you very much.
Thank you.